Well, earlier I spoke to Dr. Nirav Shah from Stanford University's Clinical Excellence Research Center. I started by asking him what he made of the numbers released by the White House that projected between 100,000 and 200,000 deaths in America by the end of this outbreak.
Dr. Fauci is one of the most trusted names when he said 200,000 American lives lost, I think he was being conservative. I think that if Americans don't start to act now, we will be in much worse shape than we are today. Every 3 days, the virus doubles in the community. We know that. And so even a day's delay leads to 40% more cases in the community. From the best estimates across the world, approximately 1% of cases is leading to mortality. That 1%, today we have approximately 143,000 cases diagnosed in the United States. That is a vast understatement of actual cases in the United States. I know in my own clinic, I probably sent home a dozen people who I could not test because they didn't meet criteria, and yet they probably had COVID in the community.
Donald Trump, for weeks, tried to downplay the severity of coronavirus. He's had to reluctantly backtrack from his original aim of opening up America by Easter. Has his stance, in your view, will it have contributed to an increased death rate?
Yes, and the problem is there's a false choice between lives and livelihoods. And if you're trying to keep the economy going and you think that the only way is to have people working, the reality is we need to first catch the disease, tamp it down, and then let people get back to work. We have no coherent policy across the U.S. on how to do that. My belief strongly is that we have to err on the side of saving lives, and then we can get back to livelihoods.
But I mean, Donald Trump expressed the view that the cure could be worse than the initial problem. I mean, there is a sense, isn't there, that if you're forcing people not to work and people are going to be physically inactive during lockdown, there are serious consequences to that, aren't there? Health consequences.
This is unprecedented. We have nothing to compare this to. So when we're trying to say that this is going to be bad, yes, it's going to be bad. It's going to be much worse than any of our collective experience. The only glimmers of hope in places like South Korea, Taiwan, and elsewhere where they've started to control the disease is that this is controllable. But it takes a much more serious, concerted public health effort. It includes self-isolation, quarantine, and other measures that we simply have not done as a nation. So it's outside our realm of experience. That's why it's so hard for people to understand how serious this is and how important it is. And it is going to have tremendous long-term consequences to our economy.
When you talk about the fact that this is unprecedented, are you able to compare what's happening now with the Spanish flu, for example, or is that just comparing two entirely different diseases?
Well, in some ways, it is like the Spanish flu. It's much more virulent than anything we've faced. It's about 10 times more likely to spread than the common flu. And so when we start to bring our mental models of what the flu looks like, oh, the flu is going to go away in the summertime, those things don't hold up. And so perhaps the Spanish flu and other diseases that we don't remember are the best models to use. When you're infecting 5, 10 people for every case, compared to a much smaller rate with the flu, the models of the flu don't hold up when it comes to coronavirus.
And just finally, obviously, your healthcare system there is very different from the British healthcare system. Is it the case that the poorest in America will end up being hit hardest by coronavirus because they don't have access to the same kind of healthcare?
Yes, the NHS has been a wonderful example of what we should learn from. And in the U.S., we do not have a healthcare system. We have multiple small areas, each approaching healthcare differently. The homeless and those without insurance are the ones that I worry most about. They will be hit the hardest. They will harbor the virus longer than other populations. And we don't have good solutions today on how best to address them.
Nirav Shah, thank you very much for joining us.